Golden Days Radio presents Talking Wellness with Dr. David. Indeed, it's Dr. David time, and good morning to you, Dr. David.
Good morning to you, Alex, and good morning to all our listeners.
Now, I see the topic is a very interesting one, and one that interests me, so I'll let you tell our listeners what it's all about.
Kidney stones. Yes. You know, about 4 to 8% of Australians are going to develop a kidney stone. And more importantly, kidney stones are 4 or 5 times more common in men than in women. Don't quite know why. Mind you, the name's something of a misnomer, because kidney stones are not really stones, and they're not really in the kidney in most cases. But what we call kidney stones, or renal calculi, are in fact crystals that form in the urine in the ureter. And the ureter is the tube that runs from the kidney down to the bladder. And therefore they should truly be called ureteric calculi. The ureters are quite long, funnel-shaped tubes. At their narrowest point, and that's just as they enter the bladder, they're around 5 to 7 millimetres in diameter. The ureters have a nice muscular wall so that they can contract, and they push things along the tube. And, as I'm going to explain in a moment, this is the whole nature of the problem with kidney stones. The great majority of kidney stones, about 3/4 of them, are made up of calcium combined with either oxalate or phosphate. About another 15% are made up of uric acid crystals, and the remainder are made up of other chemicals in the urine, mainly cysteine and struvite. Now, these stones form when the amount of chemical in the urine is increased. But in many cases, that increase is caused when the urine becomes concentrated. And stones may also occur when the flow of urine is impaired if the ureter is partly blocked, or where there are many urine infections. As I mentioned, stones are more common in men, and they generally occur between the ages of 30 and 50, and the risk increases a little with increasing age. And there's an increased risk of stones when other members of the family have suffered from kidney stones. A small number of people will develop calcium stones due to overactivity of the parathyroid glands near the thyroid gland in the neck, and of course recurrent infections can lead to struvite stones. Uric acid is a normal constituent of our urine, and uric acid stones may occur in people who have gout or have a high level of uric acid in their blood. However, most of the stones occur when the urine is concentrated, and therefore there is a greater likelihood of chemicals in the urine forming crystals, and these crystals coalesce into bigger crystals, and that makes the so-called stones or calculi. Now, about half the people who get one kidney stone will get another stone within 5 years. But after that, the risk gets less. So what are the symptoms? Well, many kidney stones will pass without any symptoms at all, but there are 3 significant symptoms of a kidney stone. The first is pain. The second is blood in the urine, and the third is nausea and vomiting. Usually the first thing that's noticed is pain, and it's very severe. It's usually quite severe enough to cause nausea, vomiting and sweating. And the pain occurs when the stone begins to move down the ureter from where it was formed. The muscular wall of the ureter contracts, grabs the stone, and that causes the severe pain. And the pain, which is usually called renal colic because it comes in waves like other colics, bowel colic, gallstone colic, it's griping and it's spasmodic. It builds up, it dies down. It's felt on one side, usually in the lower rib area or the loin, and spreads down to the front of the body and right down into the groin. There may be some obvious blood in the urine, or sometimes the blood's only found when the urine is tested with a dipstick or looked at under the microscope. If there's infection in the urine, there may be fevers and chills. And most stones can be seen on an ordinary X-ray, and this will confirm the diagnosis of kidney stone, but it also gives an idea of the size of the stone and whether the stone can easily be passed. The first thing to do with kidney stones is relieve the pain, and this may be done with strong painkillers such as morphine, and they're often used together with other drugs that will reduce the spasm of the ureter, reduce some of that muscle activity. And it may be necessary to use an antibiotic if there's an infection. Most stones will pass by themselves. Any stone that's less than 5 millimetres in diameter will pass without surgery. And stones from 5 to 7 millimetres will generally pass by themselves. It's advisable, if you've got a kidney stone, to pass the urine into some sort of container and then strain the urine to catch the stone. There's two reasons for this. One, it makes sure that the stone has actually been passed. But more importantly, it means that the stone can be sent to the laboratory and analysed to see what it's made of. Any stone above 7 millimetres may need some type of surgical intervention, although cutting is very rarely necessary. Nowadays, stones that are less than 2 centimetres in diameter can be broken up using an ultrasonic shock wave, and that directs ultrasound at the stone and sends a quick shock wave that breaks the stone up, cracks it up into little pieces, and they can then be passed in the urine because they're under 5 millimetres. Stones that are just too big to easily get through can sometimes be caught down in the end of the ureter, and they can be removed by passing an instrument into the bladder by way of the urethra up into the ureter, and the stone can be pulled out very, very gently. And that's been going on for many, many years. So, how do we prevent the recurrence of kidney stones? Well, here's a couple of don'ts. Don't drink milk with a lot of calcium. And tea contains oxalate, so don't drink too much tea. Mineral water is okay, because it only contains very small amounts of mineral. If we can find out what sort of stone it is, that can be helpful, because dietary changes can sometimes reduce the amount of calcium in the diet or the amount of uric acid precursors, but, and I'm going to say this is a very big but, don't change your diet until you've talked to your doctor or your dietitian. Occasionally we may need to use drugs to get rid of calcium or uric acid, but again, talk to your doctor first. The most important single thing that you can do to prevent another stone is drink plenty of water. Try to avoid dehydration, and we've talked about that, especially in the hot weather. And try to keep your urine output at around about 2 litres a day. And by doing that, you will immediately halve the risk of another stone. So there it is, a very painful condition, but keep up the water and you'll find that you've got very much reduced risk of a further stone.
Very wise words indeed, and we thank Dr. David for that program, and I'm sure there'll be a lot of interest out there. Thank you, David, for that.
My pleasure.
Comment and opinion is offered by Dr. David, a medical specialist with the best of intent. However, both he and we strongly urge you to consult your own doctor should you have any troubling or ongoing health issues.